The large vessel. What are the large vessels? Those are those big, and when I say large, they're really not that big in the head. They're just the big vessels in the head. The middle cerebral artery, those are the big arteries that supply the blood to everything else. And the large vessels get their blood supply from the carotids and the vertebral arteries. Large vessel disease. You may have some stenosis where those carotid arteries get thrombosed over years and years and kind of get stricken down. And then stroke is the most common type that you see from large vessel disease. And the locations that are affected by a large vessel rather than with the small vessels, it's a minute area depending on where it is. If you have a stroke in one of these large vessels, it can affect a whole entire area because those supply blood to everywhere in the head. When you guys pick up people with a large vessel stroke, you're going to see a lot of the same symptoms with the small vessel. You're going to have the hemiparesis, or maybe only one arm doesn't move, maybe all four are weak or not moving. These people are usually going to have more visual deficits. They'll have the speech difficulties, more of the facial droop, and the aphasia. Does anybody see anything funky on that picture? If I was looking at large vessels, when you're looking at CTs, you kind of look side to side. Both sides should look kind of about the same. But on this one, can you see where right here it just stops? That tells us, if I see that when you guys bring them in and drop it off, we're usually getting the TPA kit and calling IR because we know that one's got an occlusion. Large vessel outcomes are not very good. The mortality for these is high. It's the leading cause of long-term disability. Only or less than 50% of these people are functional at 1 year, whereas before it was to 97%. Their survival rate, they have a 15% mortality rate in that first 30 days, and they've only got a 65% survival rate at 1 year. So that's why large vessel has become such a focus